Well, good morning. We're here at Toronto City Hall this morning, and I'm joined by Dr. Kevin Smith, the CEO of the UHN, which is one of our most distinguished among many healthcare organizations that has hospital brand names well known to you, Toronto General, Toronto Western, Mount Sinai, and with Councillor Joe Cressy, the chair of the Board of Health. And Dr. Smith represents a team of people who are here in the City Hall today that are drawn from the community and drawn from all parts of the healthcare system to operate a vaccine clinic. I think it probably would be the first of its kind here in the rotunda of City Hall. And it was his idea, I'll give him credit for that, and I immediately embraced it because I think there is nothing more symbolic and substantive than to have in the place that people are so familiar with in our city, the place where they can come, and they do come for celebrations and for vigils and for protests, that they can come here and get vaccinated. And we are, of course, urging people over the course of the day, starting about now, to come here. The province, Premier Ford and others have lowered the age of eligibility to 12 plus for those who wish to get vaccinated, so that we're encouraging families to come here as part of the cause that we're all engaged in, which is to get people to get vaccinated so that we can keep people healthy, most of all, but also so that we can reach those threshold levels put in place by the province to allow the city to open again. As of this morning, there are already thousands of people who have taken advantage of the change in the eligibility rules. And also, over the course of the weekend, I'm very heartened to say, because I started on Friday saying that we had 14,000 unbooked appointments in our city clinics, and that number has dropped down to now less than 5,000. But what that says is that there are still opportunities between now, Sunday, and Monday to book an appointment by going online at toronto.ca or using the phone number that I can't remember in my head, so I don't want to recite it. But it's important. It's important to the well-being of yourself and your co-workers and your family and your neighbors that you should get vaccinated. We're making such incredible progress as a city, and now we just have to keep the momentum going, even on a holiday weekend. And frankly, all these rules that are in place have limited the number of things that you can do, although there was some good news with outdoor activities this weekend. But if you need something to do, this is a really great thing to do for yourself, or take someone else who hasn't had a chance to go as yet and maybe just needs a little bit of encouragement. So I thank the people of Toronto for what has been a magnificent team effort we've all made so far, community health organizations, all kinds of people, and let's get on with making sure we have a big finish up to the holiday weekend where people come out in huge numbers to get vaccinated. And so I will answer some questions, and I'll see if also my two colleagues here want to say a word as well.
Mayor, talk about the symbolic nature of this. I don't think anyone's been inside City Hall since this pandemic began, and now we're going to get people vaccinated here. You touched on it briefly. This is a place that's the beacon of civic duty here in our city. People come here to celebrate, they come here to grieve, and now they're going to come and get their first jab.
You know, it's interesting that most people may have been to Nathan Phillips Square for some fireworks or for a vigil or something like that, but many people have never been inside this building. And it is, I think, very important that people should know that we thought it important enough to open a building that has been closed during the pandemic for health-related reasons, but we wanted people to come inside. We wanted them to feel comfortable, to feel welcome, and to make sure this public space, the ultimate public space in our city, was being put to good use of the UHN and the other community organizations that are putting on this clinic today. And I should say that just to make it even more inviting, there's music inside and outside, and there's even some ice cream, and there's about 2,000 doses available here. And so there are some people that have lined up early, but there's going to be, I think, lots of opportunity for people to come to this very public place they know so well and hopefully feel very comfortable getting vaccinated here.
No question, we're making tremendous strides in getting people vaccinated. Yesterday, the numbers from the city, more than 1.9 million so far. We're waiting for the numbers today. The province now hitting more than 8 million vaccinations, 1 million in the past week. How encouraging is that for you, and knowing that the key to opening back up is for people to get vaccinated?
I look at this on a continuum, and I say that 15 months ago, we didn't even, or 16 months ago, we didn't know there was such a thing really as COVID-19 in pandemic terms. Shortly after that, miraculously, vaccines emerged. And shortly after that, cities like Toronto and others around Ontario and Canada and the world were able to put in place very effective programs to make sure that by now in Toronto almost 2 million people have had their first dose, and some have had second. Now the challenge is just to keep the momentum going, because we know we have a further distance to go in order to make sure people stay healthy and in order to make sure that the city can get reopened again. There are places that have been closed for months And though that means jobs, and that means incomes, and it means people's well-being and the ability to feed their families. And so we've got to keep going for the two reasons: the good health of the people, but also the good health of business here and getting back to a normal life that people can enjoy over the summer.
I want to ask you about outdoor amenities. First day reopened yesterday. The golf courses, all the tee times are taken probably now and right through Thursday. How did the first day go? Both in the links, on the tennis courts, the splash pads?
There was very full use of the outdoor amenities because people were starving. I mean, people, I ran into an older couple yesterday, a little bit different, but they had literally, one of them was very concerned at their age about COVID-19, had not been out of their condominium apartment for 4 months. And this is the kind of thing a lot of people have been only out for the most sparing of occasions, and that's what we wanted people to do, is to stay home by and large. But I think the chance now to get out, and whether it's to take your kids to a splash pad or to have a game of tennis or a round of golf or just to go for a walk in fully open facilities, was something that people were yearning for as the weather got better. And I think that will actually help good health, mental health and physical health. And as long as people follow the rules and wear the masks and do the things that they're asked to do and get vaccinated, I think that this is all extremely encouraging, and as is the total of people who are getting vaccinated, including this weekend.
Second last question for me. Long-term care homes finally allowing visitors to come and see their loved ones for the first time in well over a year. What does that mean to you as someone who has heard from these families just desperate to see their family members?
I saw on CP24 yesterday an account of a person who had not seen their mother for months and months. I think it was literally almost 12 months. And this is an extraordinary, tragic thing. Not tragic in the sense there wasn't a bad ending to it. There's a good ending in that they can now see loved ones and so on. People can. We've tried to use technology, but it's not the same. We all know that an iPad visit or a FaceTime visit with somebody is not the same as being able to give somebody a hug. And even if you can't hug them, if you can be in the same room and just have them know you're there. So this was a very important milestone as well. And I think what we have to focus on is just that vaccinations and following public health guidelines are all part of that. It will allow us to see people we haven't seen, to hug people we haven't hugged, to get a haircut. I have 3 people that I've gone to get my haircut with for years, and they haven't worked in months, not even a bit, because they've been precluded from doing so for public health reasons. And on it goes. Kids getting back to school eventually. So I think that's why it's important to get vaccinated and to follow the public health rules, because there are wonderful, wonderful, heartwarming results that come from this, which I think contribute to good health as well. There's no question in my mind that if you're in a long-term care or a hospital and you can't see people, that's not going to help your recovery or your ability to stay in good health. So these are important milestones.
Go Leafs go. I know you're the captain of Leafs Nation, Mayor. A big win last night by our boys in blue. What did you think of the game?
I will confess to being momentarily disheartened, although I never lose faith. I mean, at my age and after all these years of watching the Leafs, I was around when they last won the Stanley Cup, which ages me. But when they had the first goal scored on them last night, I thought, oh no, here we go again. But they recovered very quickly from that, and they showed, I don't even think they showed their full potential last night. I think that they're going to go into the Bell Centre in Montreal this coming week, and they're going to carry out their part of what I predicted is Leafs in 6. And so that does mean Montreal does win 2 games. I'm not sure when we'll give them the other one. We won't give it to them, but it'll happen maybe. I hope not, but they're doing well. And I think they were doing it as well, inspired by John Tavares and just his recovery, because he, on top of being a great hockey player, he's just such a decent man. We are so lucky to have somebody like that playing hockey in Toronto. And so I think they were inspired by that last night too, and hopefully will be through the series. Okay, now, Kevin and Joe, would you like to say anything?
Dr. Smith, may I? What does it mean to you, Doctor, to look around and see so many members of your UHN team giving up their long weekend to be here vaccinating? It's also far different than when I remember over Christmas and Boxing Day, when, no question, we didn't have the vaccines back then, but a lot of doctors back then were saying, hey, I'll vaccinate on my front lawn if it means giving up my time just to get this done. And here we are. We've come a long way.
We've come a long way, and real thanks to those colleagues who are here today. Thanks to their families. They're not with them, as many of us would want to be. Also thanks to the Mayor and Councillor Kresge for welcoming us to their house. It was really an important optic for us, not only to be doing this on this 24th of May weekend, but to be doing it here at City Hall, at the center of civic discourse and civic action. And I think to see that we're now at 50% as a nation, we really are starting to get ahead of this thing. And we're so excited about the opportunity to get back to quasi-normal as we start looking after patients. The other issue for us is while we're here to help prevent COVID and help COVID patients today, we also know there's a lot of other patients who've been waiting for care. This is a really important step in helping us get that other group of patients who we so wish to care for back on track.
What kind of outreach went into this today? Because I know generally locations are never chosen by accident. They're chosen to target a specific group of society and a specific community. So talk to us a bit about the efforts that kind of went on behind the scenes to making this come to fruition today.
Yeah, all of our amazing logistics people, both from the city and from UHN and from the vaccine team and vaccine task force, have been absolutely fantastic. There have been a lot of, and the mayor's been, I think, at most of them, pop-ups and other clinics around the city, often in the periphery or outside the central core. We thought this day, at this time, and particularly looking at some of the equity-deserving groups, our St. Jamestown partners, some of the partners in the Parkdale group, they're very close to City Hall. And it was also really important that we said we want a place where everyone can come together. We also know that just this last week we've heard that we can go down to beginning inoculation of 12-year-olds. And what better place and what better day for the whole family to be able to come than City Hall for their vaccine and to begin the process of ending this pandemic.
Here in Toronto, you do not require parental or guardian consent for a child 12 and up to get a vaccination. What do you say to parents who are maybe a little frustrated that they don't necessarily get a say or have a say in this? What do you say to them to kind of calm their nerves as well about their children, their most precious family members getting a vaccination?
So my hope is that every child and every parent will have that conversation. And I hope that most will, if not all, understand why vaccine is a good idea, reject the anti-science that some people have been spreading about these vaccines, and recognize that kids are often those who get infected but don't show symptoms, spread the disease, and then unfortunately the grandparents in the very same family can be very, very ill, some of whom are in the ICU at Toronto General or Toronto Western today. So again, I hope every family engages in the discussion, and I hope with evidence they'll come to the same conclusion that it's a good thing for people to get a vaccine down to the age of 12, that the science is solid, that all of the scientific organizations have looked at this, and this is now the international approach that we're taking. And with time, I suspect that these numbers will go even lower, that will go below 12. And just as we see kids getting many, many other vaccines, this may well become part of that vaccine regimen all kids experience.
Last question from me, Doctor. We're seeing or hearing from reports that began on vac centers last night that some clinical staff were subjected to verbal abuse, people showing up trying to bully staff members to giving them their second dose. I'm curious, is this something that your staff has experienced at any of UHN's clinics, and how do they deal with that?
Yeah, unfortunately, a very, very, very small minority. So we have experienced that, but the vast majority, 99% plus, have been gracious and welcoming and generous, and really we've had a great time undertaking this work and serving these patients, which is why we're here. So there are a minority of people, and unfortunately, that we deal with that. Our staff are trained in de-escalation procedures, and so we kindly but forcefully have to say we can only follow the rules as they are for today. Please stay in touch with us. It won't be long, and those second shots will be coming out. And the really good news with the volume of vaccine coming into Canada, hopefully that'll become quicker and quicker, and we'll have fewer and fewer people who are upset about the latency between their first and second dose. Okay, thank you.
Thank you. Thanks for coming today.